At any given time in Ohio, area agencies on aging serve over 31,000 older adults through the Passport in-home care program. While Ohio taxpayers pay an average of $62,000 a year for a senior to be in a nursing home, Passport provides the same kind of services to frail seniors for a third of the cost to taxpayers. Passport supplements the care provided by the seniors' loved ones and helps keep them where they want to be, at home. To provide a sense of how the dynamics of a family served by the Passport program can change over time, we'll flash back to when we visited the Carter family 3 years ago. Mr. and Mrs. Coy Carter received help from their son Lewis, which is then supplemented through a Passport home health aide.
You know, when your parents get sick and you got to start dividing your time between your home and over here, you know, it can really just tear the family apart. You know, you have a mortgage to pay, you have to go to work and earn a living. Without Passport, I'm not so certain that we probably would have to put my parents in a nursing home without Passport.
They come here up, take care of me. Wasn't with them, I probably would be in the nursing home.
The program, you know, it allows you a little more time to yourself, actually. You know, Tequila wasn't coming here every morning to feed my mom breakfast. After working a night shift, I might be coming here to feed my mom breakfast every morning.
Well, I'm diabetic, so I had to go to dialysis and all that stuff. Then my wife got sick. She went down with Alzheimer's.
A few years ago, when my mom and dad were both hospitalized and very sick, I thought I was losing it, you know. Had to run my dad to dialysis every morning in the car and come back and take care of my mom all day. You know, it was very, very stressful. Passport stepped in and caregiver support stepped in and actually ordered a van every day to transport my dad to and from dialysis. So that helped out a lot.
Well, it's been real helpful. Been nice. I get Meals on Wheels. I don't know what else I get. I get what they got for me.
I mean, everything you see around here pretty much is due to the Passport program. The wheelchair ramp, I think 2 years, 2-year waiting list, and once Passport got involved, we had that wheelchair ramp within 2 months. I mean, as far as the guidance, you know, because when people get sick, if you've never been in that situation before, you just don't know what to do. You know, you got to have some guidance.
A lot of the kids spend all night.
It kind of keeps the family together, actually, you know, for all of us to be meeting up here or all of us to have responsibilities around here. My dad really enjoys the companionship of having his kids, being able to see his kids at least once a week, you know.
It's all right to be in the nursing home when you have to be in there, but I prefer to be home.
Like these situations could actually pull your family apart or it can bring them closer together. And with a program like this, Aiden, you know, you never really know what's out there until you ask. Until you ask the program. They're there to help you.
Coy Carter passed away about 2 years after this video was shot. Before his passing, his son Lewis stepped in to provide care to his parents until the end, when he couldn't give anymore, passing away unexpectedly at age 44. Suzette Cygnus had been hospitalized 5 times and in and out of nursing homes 3 times during a 6-month period due to her multiple serious health conditions. Then she turned to Passport. In spite of her being eligible to live in a nursing home at taxpayers' expense, she now lives a fairly normal life at home thanks to Passport.
It took me a while to realize, or I should say, to accept it, that I couldn't do everything I wanted. I needed help for this, I needed help for that. And it's a very hard thing to accept. But I have good kids, thank God. They weren't prepared to take on elderly people as far as their jobs. A lot of jobs, especially now, they won't even let you to take off time for their doctor's appointments. And they have their family to cook for. I mean, they may work 12 hours a day themselves. I know my son does. And it's very difficult to run them around and come over and say, well, I'm running your sweeper today and cooking for you. Passport means everything to me. And how they have benefited me, I've been able to stay in my home and have help and be able to live my life. I won't say normal, but as close to normal as I can. Allows me to have Meals on Wheels, transportation, any medical things I need, like my walker, my bed. They're very good to work with. One of the rehabs I was in, they said that you could go outside if they had someone to take you outside. I never got outside. I would love to go outside. I missed the whole year from going outside from March to September. I never got to go outside. I was restricted to my room unless I had an aide push me down the hallway with a portable oxygen. Nah, you're restricted. I don't care what they say. Now if I go outside, I could take my portable oxygen and I could sit outside for an hour on my porch. This just gives you more freedom to be in your own home. And also if you have pets, you get to keep your own pets instead of getting rid of them. I mean, a pet helps an elderly person. I know there is a hardship, a big hardship. And people just have to realize it and be a little more sympathetic toward the elderly. I mean, gosh, we've all worked all our life and paid taxes. And I mean, we don't like to be in this position either. And we are. And it means the world to us to have someone to help us out.
Marcella Mackenzie stayed at home till her 93rd birthday, thanks to the partnership her daughters formed with Passport. Linda Mackenzie had just retired from her position as assistant to the president of a large university when their mother required constant care. Thanks to Passport, Karen Canablo was able to keep her administrative assistant position at Owens, Illinois, while sharing responsibilities with her sister.
I was working at the University of Toledo and getting close to my 30 years when Mom fell, and I knew I couldn't work full-time and care for my mom, and so I did retire, and as a consequence my salary was almost cut in half.
And with Linda taking the retirement and taking the brunt of the care for Mom, then every other weekend I would take her. So that meant I worked 5 days a week, and then my total weekend was 24/7 care for Mom. 24/7 care, one of us is going to go nuts. With Passport, it helped us also because we're not trained in taking care of an older person mentally and everything. So if we had not had Passport and Mother's money had basically run out and her Social Security was all she had, and taking her to daycare, say even 3 days a week, and her medicine that she needed, that wasn't enough to even pay for her bills for a month. She has dementia, so she doesn't know what's safe for her.
And she doesn't think anything's wrong with her.
Yeah.
She can just get up and walk.
I never knew where she was. She'd be walking the halls or so you don't get a good night's sleep, and then get up the next morning, and I would get her ready just like a 5-year-old. I'd have to dress her and tell her how to brush her teeth and all this stuff, and put her in the car and take her to a daycare center and pick her up afterwards. I said, haven't I done this before? And it's like that what I did with my own children when they go to a daycare center, but we just did it.
Grandma was in a nursing home, and so I was exposed to a lot of that, and I didn't want that for my mom, and so I wanted to do whatever I could to keep her with us. So thinking of her quality of life, and I think because I saw how she took care of her mom, I wanted to take care of my mom, and I didn't want to put her in a home. I wanted to have no regrets. I wanted to do everything I could so she would have quality of life as long as she could. And it was Passport and these programs that helped me and made it a little easier. I have no regrets, but I'm very thankful for the program that we were able to do what we could for our mom.
We're all trying to save. I have, I've saved, planned for my retirement. But all you need is one major thing to go wrong. And we just don't know when our time will be, but it's going to happen to all of us. It's your parents. You gotta think about it. In a blink of an eye, you're going to be one of them.
We didn't think we'd be doing it either.
Yeah, and you're 40 now, but in a blink of an eye, you're going to be one of them.
You hope that your kids and your grandkids see that you care for each other, you care for your parents, and you care for your children, and hoping at some point that we are kind of a role model for the next generation coming up, that you don't throw away or discard people when they get old or because they can't do the things they could always do before. And there's dignity, and we've tried to give our mom dignity in what we've done, and hope that our kids and grandkids see that.
The Passport program, administered through the Area Office on Aging of Northwestern Ohio, is the long-term care option that saves taxpayers' dollars and makes sense for older adults. Passport is 1/3 the cost of nursing home care. Passport allows older adults to remain where they want to be, home. Instead of replacing the family, Passport supplements the care that family members provide. For each older adult who transitions out of a nursing home and into Passport, the annual savings to taxpayers is about $40,000. But the improved quality of life to that older adult is priceless.